I think what we're particularly anxious about is what we saw as emergency arrangements with the COVID-19 data store are now being pushed through, and in a very, very quiet way, they're being pushed through as something that should happen on a more permanent basis, and that's being done without our consent. So just to explain a little bit further, what was announced last week is that the Secretary of State has issued what's called a direction that GP data should be transferred to NHS Digital. And also there's some in the white paper, there's some social care data that's also going to be required to be transferred up to NHS Digital to collect together in one space a huge kind of mass data set of health and social care data, which NHS Digital will then hold. There has been no attempt to get consent from patients at all about this. When this was attempted before in 2014, every single patient was written to and their consent was requested. This time, that hasn't happened. There's been a website put up, a few tweets put out, which basically says, unless you opt out, then there's an assumption that you've consented. And we have real concerns about whether that is in fact lawful under data protection law, and we're kind of looking into that further. But also, I think it makes huge questions then arise in terms of what is NHS Digital going to do with that information? What limits do they have in relation to that data? Who can access the data? For what purposes can it be used? Is there a meaningful consent framework that permits patients to, for example, differentiate between academic and for-profit access? If data is going to play such a crucial role in our health service moving forward, it must be that there is a proper democratic mandate if these sweeping changes are going to be brought in long term. And we definitely need to demand to have our say in it, because I think the experience we've had through the pandemic and with the data store, unless you demand it, it gets crept in via the back door.